Hello, and welcome to the Sex and Wellness Podcast. My name is Dr. Mary Grimberg, and today I'm here with Dr. Jessica Warnecke. She's an orthopedic and pelvic floor physical therapist here in Austin, Texas. She's also the owner of Pace Physical Therapy. She works with active women dealing with pelvic floor dysfunction, hip and low back pain, and she works online and in person. Thank you for coming today, Jess.
Yes, thanks for having me. I'm excited to chat.
Yeah, Jess and I go way back to when we worked in corporate, maybe like 2014 or something?
Yeah, 2014, 2015.
Yeah, it's been some
crazy.
time. Yeah, you branched out on your own a few months before me, so it's been quite the journey, and we've been really working kind of parallel in our practices and branching out and really, seeing what works for us.
Yeah, it's been really fun, I think, to look back on
Yeah.
what all we've done and where we've come.
I just think it's cool kind of going through this journey with you, and just, because it's so vulnerable and it's scary. And, when you leave corporate, you're like, oh my God, what did I do?
Yeah, the security of it.
Yeah.
Yeah, absolutely.
So we'll jump right in. So today we are reading a question from Cindy. So Cindy is 50 years old. She's from Phoenix, Arizona, and she's reached out to say, "Hi, Dr. Mary. I keep trying to run, but I'm still leaking. It's frustrating because I had kids over 15 years ago, but the symptoms have been the same. All I see for treatments are surgery or medications. Is there anything that can be done to help?" So let's go ahead and dive in.
Yes, this is such a great question. I feel like a lot of women can relate to these types of concerns, feelings, and just like getting to a point where they don't know what they don't know, and they don't know when to give up and when to keep pursuing options. And so I think it's an area that we can keep educating on for sure.
Yeah.
Because there's so much that we can do that can be very simple, can be very straightforward, but also can make the person feel very empowered, just understanding their body and their health.
No, totally. And I would say that, a lot of people haven't even heard of pelvic floor physical therapy. This might even be the first time that you're hearing from it. And, when you're looking at options, I just had a neighbor the other day mentioning, is surgery the only option? And if you think about it, really that sometimes, that's all people can see because, they have surgical centers may have more of an ad budget than we do. My doggy's popping up on here. And it's not as big of an industry as it should be. So we're getting there, but yes, we have a lot of great stuff to chat about today. And, it's
well, and I think to the point of, even if, people are starting to hear about pelvic floor physical therapy, I think it's still associated with being immediately postpartum.
Yes.
Or like, oh, I just had a baby. Okay, what do I do? Like pelvic floor therapy that's the only time I can use it. Mm-hmm. And it's interesting because pelvic floor is in place from the very beginning.
Yeah.
So through adolescence, we can do things for our pelvic floors, understanding what's going on or what will go on in the pelvic floor prior to pregnancy. Mm-hmm. Or even if you've never had a kid, that doesn't mean you might not have limitations with leaking or incontinence or any bowel and bladder dysfunctions. And so I think it's more important for us to talk about this part of the body like we would any other part of the body. Mm-hmm. We always hear about PT for knee pain or shoulder pain or back pain. And so we need to have that conversation with any and everything pelvic floor related too, because we just know with research and with working with patients for years how much we can offer patients that are having struggles with their pelvic floor, with leaking, with incontinence, with regardless of, the method of the trigger or the irritation. And I think it's a conversation to just keep having, and also to keep talking about with friends of friends, and just like getting the word out there, not just relying on your doctor to refer you somewhere, or thinking if you don't read it off of WebMD, then there's no other option. Like, we definitely need to do better at continuing to get more of this information available to people.
No, I definitely agree. And even so even if, you try everything and then after that point you do need surgery, well, it can't hurt to do pelvic floor physical therapy because, and the one thing that I find that if it's not surgery, it's do Kegels. And some people, they can do a Kegel fine, but it's the load to the pelvic floor that's too much that then is causing them to leak. And so really kind of breaking down what the pelvic floor is and, you know, the intra-abdominal pressure and all that, we'll kind of chat about that so people can start understanding, oh, okay, this is what could be happening versus just do Kegels. And quite frankly, a lot of people even do Kegels wrong. You know, and they're like, how would I supposed to know? It's like, well, nobody's running around looking at your vulva, you know, and unless you're going to your pelvic floor physical therapist. So,
yeah. And I think that's a good place to start too, because with a trained pelvic floor physical therapist, we have been trained in assessing the muscles within the pelvic floor themselves, their function, the nervous system interaction, the lengthening, the contracting, the stabilization, like all of these components that we would look at with any other muscle group, we are trained in for doing for this part of the body. And it's very different than what somebody might get if they just had an annual gyno exam, or, you know, with the pre and the post birth prep and recovery. And so it's important to understand there's a lot of things we look at both internally and externally. There's a lot of things we look at within the pelvic floor itself, but also with everything above and below the pelvic floor and through different planes of movement, through different activities, and even taking into account other contributing factors like stressors, like sleep, mindset, all of like past traumas, all of these other factors we have to understand. We have to have discussions about, we have to assess in different manners that we would utilize when working with a patient to get a full picture of truly what is going on with the pelvic floor and what are all the possible contributing factors to something like leaking that the person might be experiencing. Because we can't just, you know, look at one thing and think we know how to fix it if we're not getting the big picture.
No, that's exactly right. And just kind of tying that back to any other muscle in the body, right? If you know, couldn't lift more than 5 pounds with your bicep, right? You wouldn't just tell somebody, just keep doing, you know, keep trying to load your bicep to the point where it's fatiguing. It's like you would say, okay, well, at what point, you know, is it fatiguing? How many reps before it's fatiguing? How much, you know, is it, how much weight, how much endurance, all these different things that go into play. And that's why it gets so frustrating when you hear just do Kegels or just have surgery, right? Because there's so many different things. So let's kind of dive into, you know, like you were saying, assessing these different parts of the body. So let's talk about the basic function of the core and like intra-abdominal pressure and all of that so people can understand first, you know, what the pelvic floor looks like. You know, if you're listening to this, you know, if you're just listening, basically, we're going to give you some analogies on what that looks like. So then you can start understanding how things all the way down to even your ankle can affect your pelvic floor. And I feel like even just that's missed a lot, you know, not looking at it from that orthopedic perspective, because it's just another group of muscles, you know? So.
Yeah. So I think from whether you do it in session 1 or session 2, close to the beginning of assessing a body and working with somebody to help with leaking, we really do have to examine their full body and how it's moving. So I might have a patient do like a barefoot squat. So I can see, all right, how are their feet stabilizing? How's their ankle mobility? Are their knees going in or out? What's happening at their low back? Are they holding their breath? Are they, like, how is their pressure and their loading? Do they have pain in any other areas? Are they shifting to one side? There's so many different things that we want to look at from a movement standpoint that cues us into potential avenues of exploring the pelvic floor deeper once we dive in specifically to the pelvic floor itself. And especially when we're dealing with somebody that is leaking with jumping or running or lifting or things like that, we have to understand how their body is when they're doing those types of activities in order to be able to help them get back to those activities without the leaking.
Yeah, exactly. Yeah. And that's one of the biggest things is like, you know, some people are like, you know, I only feel leaking when I'm doing X, Y, Z, right? So say like, I only feel leaking when I am running, or I only feel leaking when I'm running at, you know, mile 3, right? And so it's kind of looking at, okay, well, where is that breakdown coming from? Is it an ankle mobility issue? Is it a landing issue? Is it a single leg strength issue? Because if you're, if it's affecting you at like mile 3, we know that's an endurance thing. So that's why Kegels wouldn't necessarily work, because there's something else going on that's affecting all the way up the chain, from your ankle to your knee, to your hip, to your pelvic floor, to your lumbar spine, right? And so that's why it's important to kind of look at all these different things. And so when we break down the core muscles, right, I like to tell people they look like an egg, right? So the abdominal. So the top part of the egg is your diaphragm, and the bottom part of the egg is your pelvic floor. And then your transverse is the front part of the egg, and then your deep back muscle, the multifidus, is on the back side. You don't have to necessarily remember the names, but just remembering how they work. And so, as you inhale, the top part of the egg lowers down, and then the bottom part lowers down as well. And as you exhale, the bottom part comes up, and then the diaphragm rises up too. So they all work together in that capacity. And so sometimes if the load is too much, so if you hold your breath, right? So if we hold our breath, everybody can kind of hold their breath while listening. You could feel it increases the pressure inside that egg, right? And so when you do that, sometimes the force can be too much that it puts more stress on your pelvic floor, right? And so that kind of goes into talking about like single leg strength and stability and stuff like that, right? Because if your legs are not strong and you're lifting up something that's like 40 pounds, like your kid, or, whatever it is, or 20 pounds, and you can't do that, you're going to hold your breath to do it. Not saying holding your breath is bad. It's just that if you're leaking, are you holding your breath? And if that's the case, then we got to strengthen your legs, because otherwise you're going to keep holding your breath. Yeah.
Yes. And also too, just within the pelvic floor itself, again, it's like any other muscle group. And so those muscles need to be able to lengthen and shorten. And they need to be able to do that all the way around the pelvic floor in coordination with the hip and the low back and the rest of the core. And depending on how the air is going through their body, what the load is that they might be doing, or if it's something like a cough or a sneeze or a jump where it's like a quick impact or change of pressure, we have to have the coordination to be able to include our pelvic floor with that stabilization component, regardless of what's going on. And so if we are just doing Kegels, then that's just the shortening of the muscles. And that's just one piece of the puzzle. And so we really need to make sure we're testing, okay, can a patient lengthen those deeper pelvic floor muscles? Can they feel the change in pressure? Can they then control the change in pressure based off of their position or what they're trying to achieve? And if they cannot feel a difference, or if they cannot control, then that's where we need to start working on retraining so that they build the foundation from the inside out to help everything else work well together and be able to meet the demands of their body and the pressure loads and changes with activities.
Yeah, no, that makes total sense. And so what I find actually is that so many people are so disconnected from their pelvic floor. So when I say, when you inhale, you should technically, if you're breathing through your lower ribs and abdomen, you should feel a little bit of pressure kind of lengthening in your pelvic floor. And sometimes it takes a while, right? It's like learning a new skill, right? If you wanted to learn piano, you wouldn't expect to be a professional pianist. It's a pianist,
yes.
Right? I don't know. Great analogies over here. You wouldn't expect to do it tomorrow, right? And so the way that I describe this to clients is like, just focusing on just even thinking about the pelvic floor, right? So when you inhale, you should kind of feel it lengthen. You should feel like some fullness. And as you exhale, that fullness should reduce, right? And so if you're not feeling it, don't worry. That's okay. It's just that it's a new skill. For example, you have the brain, the way that the body works is the brain then tells the nerves that go into the spinal cord and then out and then go into the pelvic floor muscles. That you have that capacity, but sometimes there's not truly cobwebs, but sometimes there's cobwebs that we need to dust off and improve that pathway. And sometimes it just thinking about contracting and relaxing the pelvic floor can make a big difference, right? And I remember when I first started doing this, even before I was a pelvic floor PT, I felt really disconnected. And I was a physical therapist for, 7 years before, diving into this part of physical therapy, and just feeling so disconnected from that area. Cause I mean, the only time I've ever talked about it, even just talked about it, was with my OBGYN, and it was, for my annual, and that's that. So yeah. So understanding and being, like you're saying, like one of the biggest things is awareness. So bringing awareness to your breath, to your pelvic floor, and things like that, because all of those things can make a big difference.
I agree. And I think another thing too that I see with a lot of clients, because I primarily work with women, and we're so used to, whether it's society or just the nature of what we do as younger kids or as we're growing up, we get so used to thinking of like, okay, think skinny, be skinny, suck in, all of this.
Oh gosh, I roll.
Right. And so we have to, so that's just something now that our body subconsciously does, and it's a natural thing for our bodies. And so we really actually have to retrain and undo that. And so I love, like, breathing is probably one of the first things I'll take a client through just to make sure that they can do it. And so if we're working on a breath pattern that's trying to literally fill up air from the bottom of their lungs to the top and all the way around their body, that forces them to get used to expanding into the back and into the rims. And when the diaphragm is doing its job, our abdomen is moving forward. And so we're doing the opposite of that, sucking and tightening in. And that can be very challenging for people, and bringing that awareness to them, and then putting them in positions and giving them the cues to figure out how to breathe correctly to get that full expansion can make a world of difference in how somebody feels and moves and functions with those deeper core muscles and those deeper pelvic floor muscles. And that comes into play not just with leaking, but with chronic low back pain, with chronic hip pain or knee injuries or things like that. And so I think, again, that kind of comes down to the importance of building the foundation from the inside out and using our breath to help lengthen and control and just bring that awareness to our bodies, so that the strengthening is easy once we get these foundations done. Like, that's the part that everybody thinks is, oh, all I need to do is strengthen, or I'm weak, I need to do more. I'm like, no, that's the easy part. We need to build this foundation first in order to allow that to make a difference with the end result.
Yeah, because it almost feels like if you're just doing strengthening, or if you're just coming into pelvic floor PT and getting internal work done, which is a big thing, I feel, and, it's like, well, that's only looking at a small part of it. And it's like, well, understanding your body and how your breath works, right? And so when you're breathing through your, diaphragmatic breathing is really kind of breathing through your lower ribs, belly, a little bit, and into your chest, but that's our primary breathing muscle. But with what you're saying, and like growing up in the 90s, it's like suck in, everybody trying to look super skinny and all this stuff. And it's like, oh my God, if you really even look at yourself breathing this way, it's not even that big of a difference. And it's just that we've been told these things our whole lives. And then now, we're finally getting to the point in society where it's like, we're getting to there. We're not there yet, but like everybody is a beautiful body. And embracing that everybody's body is going to be different. Nobody's looking perfect. And, being photoshopped is like usually what you see in general on a lot of platforms. But just thinking about, that breath, because a lot of times otherwise, when we're using our chest muscles, so our neck muscles. And when that happens, it sometimes can promote some anxiety sometimes for people, because I know before I really knew about diaphragmatic breathing, I tried to take deep breaths and I was bringing a lot from my neck, and I suffer from anxiety. And so I was just like, couldn't catch my breath. So I just stopped doing it. And even in meditation classes and in yoga, I felt like I was going to pass out. And then I started understanding, the diaphragm. And again, that's that lower belly, lower ribs, belly, all that stuff. And, some things that can impair that are also like your rib and mid-back mobility, right? So we need those ribs to expand. And if you're sitting hunched over all day, if you sit hunched over, it's really hard to breathe through. It's almost impossible. I mean, you can do it. It's just not as efficient breathing through your lower ribs and abdomen. And when you're upright, that can make a big difference. But a lot of times people's thoracic spine, so their mid-back, are really stiff. And so that can be a big component that's missed if we're not looking at that, right? And so when I get clients in the office, they're like, oh my God, I didn't think it was going to be to this degree. You know, we're talking about life stressors, we're talking about breath work, we're talking about all these different things. But yes, we're still getting to the point where we're going to get them back to their activities, but this foundational work is super important. And one big thing that we haven't touched on necessarily, but like a lot of people, not a lot of people, I'd say a lot of type A, we'll just say type A people. We're laughing because we're both type A. Type A people tend to have a tensor pelvic floor, right? Because we're kind of in this go, go, go mode. And, you know, it's something I'm constantly working on and just slowing down and taking myself out of urgency culture. But that's hard to do as an entrepreneur and business owner, but it's a constant work, right? And so if your pelvic floor muscles are constantly tight, we're not getting that full relaxation to then generate more force to then contract, right? And then that can kind of lead to leaking as well. I know I've dealt with urinary urgencies because of it. And, you know, I manage it now with what I know from being a pelvic floor physical therapist, a lot of breath work, stress management. That's huge for me because if your pelvic floor muscles are tight, you're not getting that full contract and relaxing of the muscles, right? And on top of it, your sympathetic nervous system, which is your fight or flight response, if that's constantly going, your body is constantly tense versus the parasympathetic, which is rest and digest. It calms our nervous system. It allows us to digest. When we breathe through that diaphragm, that's what that does. That activates that system. So I tell people it's a natural Xanax.
Yes. And it's awesome because honestly, if you did even just a few deep breaths or a few minutes of this focused type of breathing, you feel the results immediately.
It's crazy. Yeah.
And I have so many patients walk out of my clinic after, you know, one session, their eval, we did one thing and explained how to do this correctly. And they're like, I haven't felt this good in so long. Thank you. And it's like, this was the easiest thing, the most impactful thing. And now you have this tool you can utilize whenever you need it every day.
Yeah.
And so I think that's why it comes back to just like the foundations. Our body knows what it needs to do internally. We just have to help it get there. If it's never been taught this, or if it's fallen out of, you know, the routine, or just life gets in the way, right? And so I think that's another really important thing when we're dealing with pelvic floor limitations, especially if they've been chronic, assessing somebody's stress systems or their responses to it, what they're doing on a daily or a weekly basis. A lot of women that are dealing with leaking also will have like the urge frequency, or even like feel they have UTIs or burning. And so much of that is just tightness around certain areas of the pelvic floor. And it's not a true UTI, or it's not a true like dysfunction, you know, within the urinary system. We just have to like reconnect everything and make sure that the fight or flight gets pushed to the side a little bit when it's not needed.
No, definitely. It makes sense. All that stress management is a huge component, and actually, and the breath work. And what I find sometimes is the majority of people get better with just breath work. And, you know, and it's crazy. It's great. And people say, oh my gosh, you know, I had no idea it was just breath work. And so sometimes it almost sounds too easy that I have to explain it so much up front in what I'm describing to you guys right now, because otherwise you're like, okay, it's just breathing. But when you understand the physiology of it, right? And so when I started understanding the physiology of breath work and meditation and all that stuff, then I was, you know, I bought in, versus I've always been kind of this scientific person that's like, oh, whatever, breath work, you know. I mean, when I first started as a PT in general, I was like, oh, stress levels, whatever. There's no incorporation of that into the physical therapy world, when there totally is. It's a big difference. But no, I think, and I start on that stuff too. Like stress management, breath work is like number one thing when people walk in the door.
Yes. And so when people come in and they're dealing with leaking, usually it's been chronic in nature. And so sometimes it can be purely associated just with like a higher impact activity. And that rehab recovery plan of care is going to look different than somebody who it might be associated purely with stress or past traumas or just not, doing the little things throughout the day. And so again, it goes back to at the very beginning, if you're looking for a provider to help you with this type of healing, make sure they're asking you a variety of types of questions and they're getting this information from the very beginning so that you aren't wasting your time just doing breathing or just doing Kegels or just doing one little thing. You have all of the information from the very beginning, because that's going to help you get better a lot more efficiently, but also effectively.
Totally.
And I think it's important too, because it can feel intimidating to even try to get started on rehab for something like this if it's been going on so long, or if you feel like you've tried all of these things and it's still there and it's like, well, do I give up running or do I just suck it up? Like what are my options? And I just want to share that it can be so empowering and so within your control to heal. It just takes finding the right provider and knowing that all of the aspects for your situation are taking into account. And so I definitely would just want to make sure people understand that not all pelvic floor therapy is created equally. Not all, recommendations from one provider or the next for surgery or meds or PT are going to be in the best interest of you. And so do your research and go in empowered with this type of information so that you find the provider that's going to help you get back to whatever it is that you really want to get back to, and knowing that it might not look the same for you and your friend that's dealing with the similar things. And that's okay. We don't want it to be a cookie cutter. Like, we can't sit on this podcast and tell you exactly what to check or what to do to fix it all, because it has to be individualized to your body and to your situation and to your goals.
Yeah, I mean, it just stinks because there's only so many pelvic floor therapists and a lot of them are on wait lists, and it's just really hard to get into. So it's hard, but like the point of, like what you're saying is that in general, finding the right provider is huge because it's such an intimate area. And I liked, a lot of psychotherapists, they do, if you don't feel like a connection or you're not feel comfortable with your psychotherapist, it's well known in the industry that like you move on and you find somebody that's a better fit. And I really think that is important in pelvic floor health, because you're working with somebody that's asking you really in-depth questions about your life, right? Like life stressors, relationship stressors, sex stressors, all these different things. And so, do your research, find out who's a good fit for you. Sometimes they'll do consults, whatever it is, that's really important. And just, I can't emphasize enough looking at the overall big picture and not just internal work, an intravaginal assessment and treatment for the whole visit. I see that often, unfortunately. And I feel like that can be tough for the clients because they're spending all this time and energy coming in. And this shouldn't be something that people are coming in for more than 4 to 8 visits with.
Agreed.
Basically.
And I also think if you're within a couple of sessions, if you're not standing and loading and like retraining the pelvic floor to work with your body when you're doing normal daily life types of movements, your pelvic floor therapist is not like in doing what's in your best interest. I think it's also important to find a therapist that either is trained in the types of goals that you want to get back to or has experience. So for example, if somebody has leaking with powerlifting, that's going to look different than a mom that just has leaking when she laughs or when she coughs.
Totally different.
And not every pelvic floor therapist can help the power lifter or the marathon runner. And that's okay.
Yeah.
But just go into that situation knowing exactly what you're looking for, and that provider for you does exist and is out there, and maybe it just takes a few professionals to get you to the right one.
Yeah, exactly. And it's we see this every day. We see leaking and things like that. So I know it can be intimidating for you to go in and talk to somebody, but just taking that first step and researching can make you feel, or hopefully help you feel a little bit better about it. And, just, looking at it from that perspective. And then just the biggest thing, what we're saying is like, don't give up if pelvic floor physical therapy didn't work for you initially. And because there's a lot of different things that can be done. And like you're saying, a rehab's going to look a lot different for somebody that's coughing and sneezing versus somebody that's, a marathon runner or stuff like that. And so let's dive a little bit more into, we were talking about gradual loading and progression with leaking, right? And so one of the things that I'll ask people when they come in and they're like, okay, I'm leaking. Well, then I say, like, what activities are you leaking in, right? So if they're running, if they're feeling okay to run and that visit, I want to see them move. I want to see the movement that's causing them to leak. Because if that's the only movement that they do that causes them to leak, I'm missing a huge component if we don't look at that, right? And so I find a few different things with the running thing is, well, first of all, when, we were talking about this, like, when does it occur? If it's immediate, it could be running form. It could be single leg stability. It could be breath work.
Or not being warmed up well enough.
Yeah, making
sure. The hips and the ankles.
Yeah, doing some hip mobility, ankle mobility, hamstring stretches, or some mobility stuff for that. So those things are really, really important. And so one thing too is, if we go back to like running form, right? And so a lot of times, I see people, doing overstriding. Right. So when they're running, they're kind of bouncing up and down, and then their legs are doing all of the work. They're overextending and then pulling forward versus, hey, how about we lean forward a little bit, put more weight, a little bit more in the forefoot. And what that does too is it actually activates the front of the pelvic floor, which helps with reducing leakage. And so if you're running up and down and you're slamming really hard, that force can go up into the pelvic floor and cause some leakage versus if maybe we tweak your running form, lean a little bit more forward, try to land a little bit softer, which you land a little bit softer when you lean forward just a little bit anyway, because naturally you're not slamming into that heel strike, if that makes sense.
Yep, absolutely. And again, that's another example of how quickly your leaking could be improving with that one little tweak. Maybe everything within your pelvic floor is working the way it needs to, and it's just that extra component to be adjusted. And, on the flip side, if it's happening later on in the run, all right, cool. Let's look at the endurance factors. Let's see how, everything from the feet up are handling the load of what you're trying to do and the extent of how long you're trying to run, the surface you're running on. And there's just all those other variables that once we understand them, make it a lot easier to then prescribe a plan that works for your body where it's at right now and gradually eases you into your end goal so that your body adapts as you're challenging it rather than, doing too much, aggravating it, having to stop because now you have symptoms, and then it's just, a back and forth effort where you're getting nowhere. And it, like we said multiple times, it can be very simple and straightforward. It just takes understanding all of the information that's at play.
Totally. Yeah. And also another component in that is, running is unilateral. And what that means is like you're alternating side to side. And when you're running, your arms are moving with it. Your thoracic spine is rotating, your hips, your pelvis is moving in the opposite direction of your mid back. Right. And so in addition to that is, what are you strength training? Right. So if you're an endurance athlete, I know runners hate, like, it's a thing where runners don't like strength training, and that's fine. Not all, but it's a, it's just a thing, right? Yeah. So strength training is super important, right? Because if your hips and ankles, your calves, your knees, and all that stuff, if the muscles around there aren't as strong, they're going to start fatiguing in those longer runs. And so it's really important practicing like single leg strengthening, like lunges, things like that, cross body movements, different things to help gradually increase the strength in your legs. So that way, when you are running for endurance, we're looking at that component as well. Another thing, kind of shifting gears here a little bit, we talked a lot about ankle mobility, hip mobility, core strength, breath work, things like that. One thing I do want to tap into is that all these things work for a lot of people, but there's still some things that don't. And there are other things that you can do to help as well. And so one of those things that can happen, so if you are breastfeeding, if you are in perimenopause or postmenopause, what happens is your estrogen decreases, okay? And when that does, your muscles tend to not have as much strength, and it can increase some leakage. Okay, that doesn't mean, it's neither good nor bad. It's just is what it is. But what the thing to note about that is if you are having those symptoms, sometimes there's intravaginal estrogen. There's also like oral estrogen that, you can talk to your doctor about, all those different things to consider with that. I think I've talked about this in my previous podcast, but another thing too is going through chemotherapy. I went through chemotherapy back in 2019 and definitely lost some muscle tension in my pelvic floor, did have some leaking. And then as my estrogen restored after recovering from that, it made a big difference. And so if you're feeling that could be part of it as well. Another thing is prolapse. Prolapse can occur because the pelvic floor or because the vaginal wall becomes weakened. That can happen with pushing during childbirth. It can also happen with lower estrogen as well. And with that, you can have, that you can also have a pessary, which is an intravaginal orthotic that a lot of people haven't even heard about. And that's a thing as well. So just something to kind of consider.
Yeah. And I think too, going back to, especially the new mom phase or the postpartum, if you have young kids and you're not getting enough sleep, I work a lot with patients that aren't getting quality sleep. And that affects their performance, whether it's lifting or just, Pilates or running. We have to understand how important sleep is. And it's more in depth than just getting a certain amount of hours each night. We really need to make sure that we're getting into the deep sleep, that we're getting through each phase of sleep, and that the body has the opportunity to rejuvenate itself while we're resting, because that truly does affect how we're functioning during the daytime and with higher intensity types of exercises. And it's a factor that is so easy to we just get used to not sleeping well, or, having all of these extra stimuli throughout the evening or the early morning that take away from the quality of the rest that we need to get. And so that's another thing too. If you've tried everything and maybe you've seen some improvements, but you're not where you need to be, and sleep is a factor for you, find a professional that is comfortable educating and including sleep in your program, because there's a number of techniques we can use that help assist with the quality of sleep. And that's another factor that can really make a big difference.
Totally. And then also too is diet, right? So what you're eating, if you're constantly eating things that aren't fueling you, like processed food, a lot of sugar and different things like that, those, it's okay to kind of have that stuff every now and again. But if it's something that's a regular thing in your body, that's fueling your body. So if you feel that you're fatiguing at a certain mile, or you're not able to reach a certain component, or you're leaking on certain days and not other, that's, something to really consider as well.
Yep. Absolutely.
And, it can make a big difference. And then, and the other thing to kind of chat about before we end is, thinking about if you did have a vaginal birth, sometimes if you that's tearing through those pelvic floor muscles. And so it's really important too, almost to start moving those muscles. And I'll have people just stick their thumb in the shower into the intravaginal, into the vagina, and move their scar. It's usually on the backside, closer to the anus. And the more we can get that moving, the better those pelvic floor muscles can contract if it is an intrinsic pelvic floor issue. And vaginal weights too. So that's,
yes, I feel like we could easily do another podcast on this
totally,
conversation.
But I'm like, I want to jam in all these different things that are possible. And the goal of all this is to let you know that there's so much more just besides medications and surgery,
or giving up your favorite activity.
Yes. And so there's, like I said, so much you can do. And there's a lot of resources that are not mainstream yet, but they, sharing this with your friends and family and starting to talk about it, because a lot of people are peeing their pants, and some people are more vocal about it than others.
Yep.
So
yeah, we talk about this for a living. So there's no question we haven't heard before.
Yeah.
And we love these types of questions, because that's how we get more of this information out there, and we normalize the conversation.
Totally. Yeah. Well, thanks for coming, Jess.
Absolutely.
Or actually, I came to your
Well,
house.
yes.
Sorry if you guys hear some doggies in the background. I brought mine, and hers is in the other room. So thank you guys for listening. And if you guys would like 3 tips to help you stop leaking while you're exercising. I do have a link for that in the show notes. And thank you guys for coming, and we'll see you soon.
Bye.